Hello, my name is Brad Zeinhemmel. I'm a nurse anesthetist with the Waverly Health Center Pain Management Clinic.
And my name's Rich Jacobson, and I'm also with the Waverly Health Center Pain Clinic. Today we'll be talking briefly about some acute and chronic pain conditions and their treatment modalities. As you may have noticed in the media today, opioids are kind of a big deal. Over $1 trillion has been spent since 2001 on opioids for pain management. The Institute of Medicine identifies over 100 million adults in the U.S. suffer from chronic pain. So is opioids the answer? At a cost of $600 billion in the next 3 years, which translates to about $6,000 per person. In this country today, we have several states that prescribe more prescriptions for hydrocodone than they actually have people in their state. In a study by Dr. Nahin in 2015, he estimated that there would be approximately 126 million people suffering from chronic pain in 2017. So what is the problem with chronic opioid use? Every day in the United States, 144 people die from overdose. 91 die from opioid prescriptions. In Iowa, 10 out of 100,000 will die from overdose. 3 out of 4 of those are heroin users. In the US, we have 5% of the world's population, but we use over 75% of the world's opioids. Hydrocodone is the highest used opiate in our country. Oxycodone is a close second. Vicodin, otherwise known as hydrocodone, provides some pain relief and covering of symptoms of pain. However, it's also associated with unwanted side effects, which include fainting, confusion, fear, hives, skin irritation, swelling, yellowing, and many others. So the United States has turned to other methods of treating pain. One of these that's become popular in the media is marijuana. Marijuana actually has 2 components to it. One is the THC, and secondly is the CBD. The CBD is actually the portion of the marijuana plant that has some therapeutic effects. It affects the CBD1 receptors within the body and the CBD2 receptors that are located in the organs. The THC is actually associated with unwanted side effects, which includes slow GI emptying, increased appetite, thus people desiring the donuts and the Doritos, and immune system suppression. Iowa's law for cannabis use is under debate in the Iowa legislature as we speak. Currently, the law states that we can treat patients with cancer, multiple sclerosis, seizures, HIV, Crohn's disease, ALS, any terminal illnesses, Parkinson's disease, and untreatable pain. A couple of things to note with the marijuana law is that marijuana currently is under a lot of scrutiny for the lack of research provided to treat chronic pain. Furthermore, it is very restrictive for both patients and physicians to be able to write for this particular medicine. So what is pain? In my pain clinic, pain is whatever the patient says it is. It is a very subjective sense that no one but the patient can feel. According to the International Association of the Study of Pain, pain is an unpleasant sensory or emotional experience associated with actual or potential tissue damage, or described in terms of such damage. So when we talk about pain, we talk about acute versus chronic pain, and there is a difference. Acute pain is generally short-lasting. It is also associated with being a symptom and a pathology with a response to tissue damage. For instance, surgery. It has a biological function. For instance, you touch the stove. It hurts and you pull away. Usually, this pain will be relieved with treatment and is usually short-lasting in nature. But why does acute pain matter? Well, if acute pain is not treated aggressively, it will transition to be chronic pain over a period of time. Even though acute pain has a foreseeable end and its management should be a high priority, we still see patients that do develop chronic pain from what we consider an acute pain source. So what is chronic pain? Chronic pain is long-lasting. Its pathology is often unidentifiable. The changes occur in the brain during this time. It has no biological function and can sometimes be unresponsive to treatment. All of this can be associated with depression and feelings of hopelessness. The chronic pain cycle is how we generally look at chronic pain, and it begins with the initial insult of pain, which tends to lead to muscle tension, and then to reduced circulation and muscle inflammation, which leads to reduced movement. What happens at this point is patients tend to have a backache. They sit on the couch because it hurts, and then it ends up being a spiral of getting worse and worse over time. So what kind of pain do we treat? Well, there's many different kinds of pain. However, today we'll be concentrating on myofascial, bone, and nerve pain. Bone pain. This is a condition where there is a deviation or disruption in the function of bones. It can include diseases of the bones, fractures, and joint pain. The general treatment for this, conservatively, is anti-inflammatories, analgesics, bracing, and then we can get into more advanced procedures such as vertebroplasties, kyphoplasties, surgeries, and steroids. So the first type of bone pain that I'd like to talk to you about is the facet joint pain that occurs in your spine. This can occur in your neck, in your mid-back, or in your low back. The facet joints are joints where bone comes in contact with bone along the spine, as you can see outlined in the slide. Right outside of these joints is a nerve called the medial branch nerve, which is a sensory nerve that continually sends pain signals to the brain from these joints. These medial branch nerves will often have symptomology that includes referral patterns of the pain into different areas. So in the neck, you can see pain radiating down into the shoulder blades or up into the head. With lumbar medial branch nerve pain, you can see pain radiating into the buttocks and the lower legs, around into the groin or into the anterior legs.
Another type of pain that we treat at the Waverly Health Center Pain Clinic is chronic joint pain. In our pain clinic, we do treat pain in all of your joints. Most commonly, we see shoulder pain, hip pain, and today we're going to talk with you a little bit more about chronic knee pain. So let's talk a little bit more about chronic knee pain. 7 to 10% of all Americans are going to undergo a total knee replacement. That equates to about 4 million adults in the United States currently living with a total knee replacement. Knee pain after total knee replacement has been reported in 53% of patients, while 15% of those patients have reported severe pain post-total knee replacement. There's good news, however. If you do suffer from pain after a total knee replacement, there's a nerve block that can be done called a genicular nerve block. And this block has been shown to give significant pain relief to people suffering from knee pain post-total knee replacement. Genicular nerves are peripheral nerves that run in very reliable patterns. Here you can see some X-ray images of the needles that are used in order to deliver the medicine around these nerves in order to calm the inflammation and decrease the pain. Now we're going to transition to a different kind of pain, nerve pain. Nerve pain is pain that develops as a result of lesions or disease affecting nervous system either in the periphery or centrally. What differentiates nerve pain from bone pain is that nerve pain is generally a much more discrete pain and follows specific nerve patterns. Some examples would be polyneuropathies, such as diabetic neuropathy, which might cause pain in the hands or feet, or radiculopathy, which is commonly known as a pinched nerve. And a pinched nerve can cause things like pain, weakness, numbness, or tingling. You can also have nerve pain from postherpetic neuralgia caused by the shingles, which we'll talk about a little bit later. And you can also have post-stroke pain. Treatment for nerve-mediated pain would include medicines such as tricyclic antidepressants, anticonvulsants, nerve blocks, topical medicines, as well as physical therapy, occupational therapy, and chiropractic care. If the pain is especially severe or long-lasting, nerve stimulators, pain pumps, and different types of procedures are available. Here's an illustration of what sometimes occurs with nerve-mediated pain. In the spine, we often see degeneration of the discs that are in between the vertebra. When those discs degenerate, they can protrude out and they can push on the spinal nerve root, and that can cause a nerve impingement, which will cause a very uncomfortable sensation to follow the pattern of that nerve. Another reason that these nerves can be impinged is due to something called foraminal stenosis, and that is where the area where the nerve root is exiting the spinal column is narrowed due to arthritis or movement of the bones or a disc protrusion or a combination of all three. When you come to our pain clinic with nerve pain, we can identify which nerve root is being affected based on where your pain is. In this picture, you see a patient suffering from an acute herpes zoster or shingles outbreak. In this picture, you can see that the rash follows a linear pattern, and based on this, we know which nerve root the virus was lying dormant in, and we can treat accordingly. Acute herpes zoster or shingles and postherpetic neuralgia, or the pain that follows this, will occur in 1 out of 3 people. The older you get, your risk is going to increase. There's good news, however. There is a vaccination that can protect against shingles and postherpetic neuralgia, and the CDC recommends that people that are over 50 do get vaccinated for this. The next thing we'd like to talk with you about is myofascial pain. Myofascial pain is pain that occurs in the muscles or the surrounding fascia. It can be divided into 2 types of pain, and that can be an acute strain or chronic myofascial pain syndromes. Trigger points, or knots in your muscle that you might experience that are very uncomfortable from time to time, are a type of myofascial pain, as are just basic tender points in the muscle. There is some evidence that shows that this may be a result of a lack of vitamin, mineral, or enzymes in your body. Treatments for myofascial pain can include nonsteroidal anti-inflammatories such as Advil or naproxen, and that can be either as a cream or by mouth. We can use muscle relaxants, massage therapy, physical therapy, occupational therapy, and chiropractic care, as well as some other medicines and treatments. Here is a map that shows where some of the most common trigger points are found in the body. At the Waverly Pain Clinic by Iowa Anesthesia, we provide personalized consultation, interventional procedures, if indicated, as well as pain medication management. We do have options for treatment of chronic pain. To start, physical therapy, and physical therapy. It's very important that we get you moving and get you moving the way that you're intended to be moving. Muscle strengthening and flexibility is also very important. We'll work with you on weight loss, remaining active, and recommend chiropractic care, massage care, acupuncture, and other alternative treatments as necessary. There are medications available if we need, and we have options including injections and potentially recommending you for surgery if it's appropriate. And did I mention physical therapy?
Thank you for joining us today. My name is Rich Jacobson.
And my name is Brad Zeidhemmel. Please call the Waverly Pain Clinic at 319-483-1422 to set up a consultation.